Good evening everyone, welcome back to GDC classes. So in today's video we're going to discuss about the topic adrenergic agonists plus the PYQs of GPAT for last 10 years. So starting with the definition of the adrenergic agonists. So adrenergic agonists, they are also called as the sympathomimetic agents. Why? Because they act by mimicking the action of the sympathetic system of our body. Now, what is the sympathetic system? Basically, it comes under the class ANS or the autonomic nervous system. It is responsible for the fight and flight function. Now, if we talk about the neurotransmitters of this class, epinephrine, norepinephrine, and dopamine are the three neurotransmitters of the sympathetic system. Now, if we talk about the chemical moiety, based on that, it is divided into two types, that is the catecholamines and non-catecholamines. Catecholamines, they contain a catechol ring in their structure. What is catechol ring? It is basically a phenyl ring that has two hydroxy group attached to it at first and second position. So this is a catechol ring that is contained by the catecholamines. Non-catecholamines, they do not contain a catechol ring in their structure. Now, endogenous catecholamines like the noradrenaline, adrenaline, and dopamine. Exogenous ones like the 𝘂𝙬𝙎𝘾 and the isoprenaline. Now we have the non-catecholamines like tyramine, ephedrine, amphetamine, salbutamol, phenylephrine, all that. Now, if we talk about the basic structure or the basic backbone of this sympathomimetic drugs, it is the phenylethylamine. It contains a phenyl ring, an ethyl chain or the ethyl bridge in between that is connected to the amine group. So that is the phenylethylamine. Now next on we have the synthesis of these catecholamines. So L-tyrosine is the precursor here for the synthesis of catecholamines. In the presence of an enzyme tyrosine hydroxylase, it forms DOPA. Now this DOPA, further in the presence of an enzyme DOPA decarboxylase, it removes the COOH groups in the form of CO2 to form dopamine. Now this dopamine, if we discuss about its structure, now it is the first neurotransmitter of the sympathetic system and it is a catecholamine, so it contains a catechol ring, then a ethyl bridge and an amine group attached to that. So a simple dopamine structure. Then further, this dopamine in the presence of an enzyme dopamine beta hydroxylase. So beta hydroxylase enzyme, that means at beta position of the chain of the carbon chain, it is adding the hydroxy group. So if we talk about dopamine, so at dopamine this is the alpha and this is the beta. So here at beta position, if an OH is added, so that becomes a norepinephrine. So here this is the structure of norepinephrine. Catechol ring just like dopamine, then here we have an ethyl bridge. At beta position we have OH and again NH2 attached to that ethyl bridge. Then further this norepinephrine, if in the presence of an enzyme phenylethanolamine N-methyl transferase, so in the presence of this enzyme it forms epinephrine. So this particular enzyme allow the addition of the methyl group to the N position of this norepinephrine to form epinephrine. So this was all about the formation or the synthesis of the catecholamines. Next we have the receptors, the adrenergic receptors. So basically there are two types of adrenergic receptors, the alpha receptor and the beta receptor. Now alpha receptor further divided into two types, that is the alpha 1 and the alpha 2. Now alpha 1 receptor, if we talk about its location, we can remember it by a trick, that is the 𝘂𝙀𝙬𝘏. Now 𝘂𝙀𝙬𝘏 is the trick from V, vessels, then K, kidney, bladder, uterus, pupil, ejaculation and the nasal vessels. That is the location for the alpha 1 receptors. Then we have alpha 2, that is the presynaptic neurons. It is present there, that there it is responsible for the negative feedback system. It basically inhibits the norepinephrine release. Okay. Then we have the second type of receptor, that is the beta adrenergic receptor. beta 1, beta 2, beta 3, further subdivided into all these three. Then beta 1, we have one heart, so the beta 1, it is present in heart. Then beta 2, we have two lungs in our body, so beta 2, it is present in lungs. Then if we talk about beta 3, it is present in the adipose tissue, so beta 3 receptor. Then next on we have the classification of these adrenergic agonists. Okay, now adrenergic agonist divided into three types, that is the directly acting, indirectly acting, and the mixed acting. Directly acting, they directly bind to the receptor of the adrenergic system, okay, and they will show their agonistic effect. Then if we talk about indirectly acting, they do not directly bind to the receptor, but still they show the agonistic action. Then we have mixed acting. Sometimes they act directly, sometimes they act indirectly. That is the mixed acting. Now directly acting further divided into two types, selective, non-selective. Selective ones selectively bind to the particular receptor, non-selective, different more than one receptors they can act. So phenylephrine is the first selective acting drug that acts selectively on the alpha 1 receptor. Then we have alpha 2 clonidine, beta 1 that is dobutamine, then beta 2 that is the 𝘖𝙬𝙎𝑗𝑡𝑎𝑙𝑖N. Now we have non-selective ones like the oxymetazoline. It is selective, it is acting on the alpha 1 plus alpha 2 receptor. Then we have isoproterenol, beta 1, beta 2 affinity they have. Then epinephrine, that is also a neurotransmitter here, so alpha 1, alpha 2, beta 1, beta 2. Okay, then norepinephrine, beta 1, alpha 1, alpha 2, not beta 2. If there is an action, then it is very weak, so only beta 1, alpha 1 and alpha 2. Mixed acting, we have ephedrine. Now ephedrine, it is acting, or it has affinity for the receptor alpha 1, alpha 2, beta 1, beta 2, plus it is also acting indirectly by acting as a releasing agent. Now releasing agent means it will act by releasing or increasing the release of the neurotransmitters like norepinephrine. Okay, so that is the releasing agent. Now indirectly acting, first we have the releasing agent. Okay, so I already told you what is releasing agent. Amphetamine and tyramine are the two drugs that comes under this class. Then we have uptake inhibitors. Uptake inhibitors, they basically inhibit or do not allow the uptake of the neurotransmitters like norepinephrine, so their action can be enhanced. Okay, so cocaine is the example for that. Then we have the MAO inhibitors. Now these MAO inhibitors, monoamine oxidase. Okay, now these monoamine oxidase, they are basically responsible for the breakdown of the neurotransmitters like norepinephrine, epinephrine and dopamine. So they do not allow, they inhibit the breakdown of them, so they can act. So salicylic, they are indirectly acting again. Then we have the COMT inhibitors. Now COMT inhibitors, they basically inhibit the metabolism of these neurotransmitters like epinephrine and norepinephrine. Okay, so further next we have is the drugs. One by one we will discuss. The phenylephrine is the first one. So if we talk about its structure, now it has a phenyl ring, not phenyl, actually the phenol ring in this structure. Okay, then we have an ethyl bridge again that has an OH at the beta position and NH plus CH3 here like an epinephrine. So this is phenylephrine. Now if we talk about uses, nasal decongestant, then mydriatic agent. Mydriatic, that is, it is acting by the dilation of the pupil. Then hypotension during anesthesia, it can act that also by used at that condition also whenever there is an hypotension condition during the anesthetic thing. Okay, so that time we can give this phenylephrine. Side effects: hypertension, reflex bradycardia due to the baroreceptor reflex. Okay, so that time we can use it. Headache, anxiety, palpitations and arrhythmia, that are all the side effects of this phenylephrine. Next we have the clonidine. Now clonidine is the next drug. It is the alpha-2 selective drug, uses hypertension, then attention deficient hyperactivity disorder, that is the ADHD, withdrawal syndrome for opioid, nicotine, alcohol. It basically helps by reducing the symptoms like anxiety, then agitation, sweating, all that during the withdrawal symptoms. Then menopausal hot flashes, for that also the clonidine is helpful. Side effects: sedation, drowsiness, fatigue, dry mouth, then bradycardia, constipation, orthostatic hypertension, sexual dysfunction, all that the side effects of clonidine. Next we have the dobutamine. Now dobutamine is the beta-1 selective drug. So beta-1 receptor present in heart. So basically its action will also be in heart. So if we talk about its structure, here it is a catecholamine, so it contains a catechol ring in its structure. Then we have a bridge, the ethyl bridge, that is attached to the NH. Now from its name we can see it has a buta in its name. So from buta we can say butane. Butane means 4. Okay, so 4 carbons are there. So in its side chain we have a butane, 1, 2, 3, 4. So 4 carbon chain. So butane we have, that is attached to the phenol ring. So dobutamine structure uses, already told you that it is a beta-1 selective, so act on heart. So acute heart failure, cardiogenic shock, post-cardiac surgery support, for all that we can use this dobutamine. Side effects: tachycardia, hypertension, palpitations, arrhythmia, angina, for all that dobutamine is very dangerous, that is it causes the side effects like these. Then next we have is the terbutaline. Now terbutaline is beta-2 selective. Beta-2 selective means it acts on lungs. Okay, the function will be on lungs. Then now if we talk about its structure, now from terbuta. So from terbuta we can say tertiary butane. Okay, so this terbuta, it contain a tertiary butane compound as a side chain. Okay, now this is not a catecholamine, but it contains a ring similar to catechol, that is the resorcinol. So resorcinol is basically similar to the catechol ring only, just that it contains hydroxy group in 1 and 3rd position. So here we have a resorcinol ring here in this. Okay, so this is the terbutaline. Uses bronchial asthma, COPD, premature labor. Premature labor is a off-label use. Okay, so basically for lungs it is used, that is the bronchial asthma and the COPD. Side effects: tremor, nervousness, palpitations, tachycardia, headache, insomnia. These are the side effects for this terbutaline. Next drug we have the oxymetazoline. Now this oxymetazoline, this here is a non-selective drug. Non-selective alpha drug, that is alpha-1 and alpha-2 act on both. If we talk about its structure, now it contains an oxy, that is the hydroxy group in its structure. So here we have a hydroxy group. Plus from zolin we can say it also contains an imidazole ring. So imidazole ring also in its structure. From zolin we can remember that. Uses nasal congestion, then ocular redness, topical cream for reducing redness. So for topical, as a topical cream we can use for reducing redness. Now how it will act? By constricting the blood vessels it will act, the oxymetazoline. Side effects: nasal dryness or irritation, sneezing, then burning or stinging sensation, hypertension, headache, nervousness, palpitations, all that are the side effects for that. Now the next drug we have is the isoproterenol. Isoproterenol is a drug that contains an isopropane group. So here we have a isopropane. So from isopro we can say it has a iso propane group in its structure. So isopropane is there. In the rest of the structure, it is a catecholamine, so it contains a catechol ring. An ethyl bridge at beta position, we have an OH, so isoprotanol. Then amine group, and that amine group is attached to the side chain, and that side chain is isopropane, so that is isoprotanol. Next, uses bradycardia, heart block, then we have bronchial asthma. For all that, we can use this isoprotanol. Now, this isoprotanol is a non-selective drug at beta 1 and beta 2. So, it will act on heart, it will act on lungs. So, bradycardia, heart block, both the heart function, then bronchial asthma, it is the lung function. So, isoprotanol for that. Side effects: tachycardia, palpitations, arrhythmia, angina, hypotension, headache, restlessness, tremor. All these are the side effects for this isoprotanol. Next drug we have is epinephrine. Epinephrine, also called as adrenaline, it is a non-selective drug which acts or which has affinity for the receptor alpha 1, alpha 2, beta 1 and beta 2. So, epinephrine, the structure already discussed during discussing the synthesis, but still it is a catechol ring. Okay, it contains a catechol ring. It contains a bridge, ethane bridge, that contains OH at the beta position. Now, this epinephrine, it contains an extra methyl group, okay, that is attached to the N. So, here we have a methyl group, so that is an epinephrine. Uses anaphylaxis. The drug of choice for anaphylaxis is epinephrine. Next, we have cardiac arrest, acute asthma attack, then hypotension and glaucoma. For all that, we can use this epinephrine. Side effects: hypertension, tachycardia, arrhythmia, palpitations, anxiety, restlessness, tremors, headache. Then hyperglycemia. Why hyperglycemia? Because this epinephrine is basically stimulating the glycogenolysis. Now, due to that, the glucose that is breaking down. So, due to that, it can cause hyperglycemia in the blood. So, hyperglycemia can be the side effect for this. Next, we have the norepinephrine. Now, remember one thing: whenever there is a nor in the suffix, now this nor means that it has reduced one or it has removed one CH3 or the methyl group. So, norepinephrine, it do not have a CH3 group in epinephrine, that is called as norepinephrine. So, here the structure similar to epinephrine, just that here the methyl group have been removed. So, that is norepinephrine. Uses hypotensive shock, septic shock, acute hypotension during surgery or anesthesia. Whenever it is given for that condition, we can use this norepinephrine. Side effects: hypertension can be, then reflex bradycardia due to the baroreceptors reflex, then we have the arrhythmia, anxiety, restlessness, headache, mild hyperglycemia. It can also be caused as a side effect of this norepinephrine. Next drug we have is ephedrine. Now, this ephedrine, it is a mixed action drug, means it can act directly plus indirectly. Direct action at alpha 1, alpha 2, beta 1 and beta 2, just like the epinephrine, but it also acts as a releasing agent too, like the indirectly acting one. Now, ephedrine, it is a non-catecholamine, so it does not contain a catechol ring but a phenyl ring that is attached to the ethane, okay, the ethane bridge that contains OH at the beta position. Then we have an extra CH3 group here at the alpha position or the alpha carbon that is attached to the NH and CH3. The structure is similar to epinephrine only, just this minute differences, like here we do not have a catechol ring, just like unlike in epinephrine we have that, okay, and we do not have a CH3 in epinephrine, but here we have a CH3 at alpha position. So that is ephedrine. Uses hypotension, nasal congestion, then we have bronchial asthma, mild CNS stimulant, all that. Side effects: hypertension, palpitations, tachycardia, arrhythmia, nervousness, then insomnia, tremor, anxiety, agitation, appetite suppression, and nausea. Next drug we have is amphetamine. Now, amphetamine, it is the drug, it is, if we talk about its structure, now it has a structure, it is a non-catecholamine, so it contains a simple phenyl ring, then this phenyl ring is attached with the ethyl bridge that contains CH3 at the alpha position, that is attached to the amine group again, so that is the amphetamine. If we talk about its uses, that is the attention deficient, okay, then we have attention deficient hyperactivity disorder, that is the ADHD, it is used for that. Obesity and narcolepsy, for that also we can use this amphetamine. Side effects: insomnia, irritability, nervousness, then we have headache, tremor, tachycardia, hypertension, palpitations, arrhythmia, loss of appetite, and nausea as the side effect. Cocaine is the next drug here. It has the function of local anesthetic and comes under the class sympathomimetic agents. Now uses: topical anesthetic, nasal, throat, and eye surgery. Now this cocaine, it has a very strong side effect of hallucination. Okay, so it hallucinates. So that's why its therapeutic use, it's very low. In very rare condition, we use this cocaine as anesthetic. Okay, side effects, like if we can see, euphoria, agitation, then seizure, hallucination, addiction, then we have tachycardia, hypertension, vasoconstriction, arrhythmia, myocardial infarction, sudden cardiac death, appetite loss. So we have various side effects for this particular drug. So its therapeutic use, it is very less or very rare. Then we have the salicylic. Okay, now salicylic is the next drug here. Salicylic. So it is used in the Parkinson disease and major depressive disorder. Side effects again: the insomnia, agitation, hallucination, nausea, dry mouth, abdominal discomfort, orthostatic hypertension, all that. Then next we have is, now these were all about the drugs we have discussed. Now we will discuss the previous year questions, okay, that were in GPAT. So first is from the GPAT 2027. First question, that is: match the following adrenergic drug with their receptor affinity. So they are asking the receptor affinity for the drugs. So first, epinephrine. Now epinephrine, I told you, it acts on the receptor, or it has an affinity for alpha 1, alpha 2, beta 1 and beta 2 receptor. Okay, we already discussed that. Noradrenaline or norepinephrine, it has the affinity for the alpha 1, alpha 2 and beta 1, not the beta 2. Then we have the phenylephrine. Now phenylephrine is a selective drug, okay, selective for the alpha 1 receptor. Okay, then we have dobutamine. Dobutamine is also the selective one for the beta 1 receptor. So all these are, but if you look onto the options here that are given in your question, now by NTA the options here were given wrong. Okay, so they cannot answer the question correctly. Now if you read the options here carefully, if you read them yourself, okay, so you will get to know that these options are wrong. So hence we should know the answer, but doesn't matter the options are wrong, you should know that what the receptor affinity for this particular drug, that I have already told you. So moving forward to the next question, that is from GPAT 2016. Which of the following drugs are often found in both prescription and the over-the-counter nasal decongestant? Now they are asking for nasal decongestant drug that is both the prescription and the over-the-counter drug. Which all of these? The alpha-2 agonist, alpha-1 agonist, alpha-1 antagonist, or the beta-2 agonist? So before telling the drug, we should know what is nasal congestion. Okay, the nasal congestion is the blockage of the nasal vessels. Okay, the blood vessels that are present in the nasal, okay, the nose, that are blocked, that is the nasal congestion. Okay, now this blockage is basically due to the inflammation or swelling in the blood vessels of those nasal area. Okay, now what is the drug that can be used for this treatment? Now if we start with the beta-2 agonist. Now beta-2 agonist, now we have two lungs. So beta-2 is present in lungs. So lungs has no action on the nasal or the nose. So beta-2, we can remove it from the option. So it can't be beta-2 agonist. Then if we talk about alpha-2 agonist. Now alpha-2 agonist, it is present in the presynaptic neuron. Okay, so presynaptic neuron, there it is basically responsible for the negative feedback system. Negative feedback system, it acts by inhibiting the norepinephrine release. So it has no relation with the nasal blockage or something. So alpha-2 agonist, it can also be removed from the option. Then we have alpha-1 agonist and the alpha-1 antagonist. So out of these, which one? So alpha-1 antagonist, it is basically responsible for the vasodilation, and alpha-1 agonist, it is responsible for the vasoconstriction. So as in nasal congestion, okay, so in nasal congestion we have the swelling and inflammation. So for getting effect or getting release from that swelling and inflammation, we need the constriction of that vessels or the blood vessels, or the constriction of the swelling. So here we need a constrictor. So vasoconstrictor action is of alpha-1. So alpha-1 will be the answer for this question. Okay, now moving forward to the next. From GPAT 2022, the above structure is of. So what is this structure of? Is it of norepinephrine, ephedrine, pseudoephedrine, or nor-pseudoephedrine? Now it is a non-catecholamine. Now ephedrine, all are ephedrine. Ephedrine is also a non-catecholamine, so we don't get any help from that catecholamine thing. Now next, here we have a CH3 group attached. Okay, now I told you whenever there is a nor. So nor suffix is basically used for the compounds that have removed CH3, but here CH3 is there. So the option 1 and 4 can be removed. So ephedrine or pseudoephedrine, what is that? Now ephedrine and pseudoephedrine, they have the similar structure with only one difference. That one difference is that this OH attachment. So whenever this OH is attached with the solid bond with the carbon, that is the ephedrine, and if it is attached with the wedge or with the dash bond, so that is called as pseudoephedrine. So here we have a solid bond attached. So the answer is the ephedrine. So this structure is of ephedrine. Now next question we have, the amphetamine undergoes one of the following metabolic reaction to convert to 1-phenyl-2-propanol metabolite via the ketone formation. Now first, let's draw the structure of amphetamine. So amphetamine is a non-catecholamine, so it contains a phenyl ring that has an ethyl bridge, and here we have a CH3 group, and here we have a NH2. So this is the structure of amphetamine. Now this amphetamine, they are saying that it is metabolizing and it is converting into this particular thing, this particular propranolol, okay, and via the ketone formation. So the answer is hidden in the question only. So it follows a simple basic rule of chemistry. Now here they are saying that the metabolism is happening through ketone. The ketone is an intermediate here. So we already know that ketone, whenever it is oxidized, it gives acid. And whenever a ketone is reduced, it gives an alcohol. So here what the final product is? The alcohol, and the intermediate product is ketone. So ketone is forming an alcohol. So what the reaction will be? It will be reduction. It will follow reduction. So the answer is reduction. Okay. Simple question. In 2023 it was asked shift 2 paper. Okay. Now the next question we have, the below structure represent the drug. From GPAT 2024 it's the question. Now the below structure, it is a catecholamine structure. Now is it an isoprenaline, amphetamine, norepinephrine or salbutamol? So it is a catechol ring. It contains a catechol ring, means it should be a catecholamine. So let's look on to the names of the drug. Isoprenaline, is it a catechol ring? Yes, it does contain a catechol ring. Amphetamine, we just discussed the structure of amphetamine. It is not a catecholamine, so it can be removed from option. Then we have norepinephrine. Norepinephrine, it is a catecholamine. Yes, it is a catecholamine, so it can be. Then we have salbutamol. Now, if we remember, if you know the structure of salbutamol, now salbutamol, it has a phenyl ring. Okay, so from sal, we can say it has a structure like salicylic acid. Okay, now what is salicylic acid? This is salicylic acid. Which? So this is salicylic acid. Now the salbutamol, it doesn't contain the salicylic acid, but it has a structure similar to salicylic acid, somewhat similar. So it contains an OH here and CH2OH here. So this ring is present in salbutamol. Then rest of the structure is similar to the normal 2NH. Okay. Then from buta, we can remember that it contains a butane also. So here with NH, a butane is attached, the tertiary butane. So this is the structure of salbutamol. So salbutamol, it doesn't contain the catechol ring, so, and it even not contain the isopropyl group, so it is not in the option the salbutamol 2. Now we have two options left, that is the norepinephrine and the isoprenaline. Now if you remember norepinephrine, now nor means it does not contain a CH3, the CH3 has been removed, but here in NH we have an isopropyl group attached, so it can't be norepinephrine. So hence the structure is of isoprenaline. So from iso also we can see isopre, we can say it has an isopropane group. Okay, so the answer is isoprenaline. So this was the last question that we are discussing from GPAT in this video. Hope you understood the theory part, plus you understood the MCQs, how to solve these. So thank you for watching the video. Thank you so much.